The main purpose for that conversation was to allow all of us to think to ourselves, how do I interact with that particular barrier? But we want to open up, how do you feel about changing the game for the people that are on your team? What were some of the reactions that people had to that question?
Changing the game can be very different depending on the person on your team you're dealing with. Some people are going to adapt well, so you have no problem changing the game with them, and some people are not going to adapt as well. So it depends on which team members I'm working with.
It might have a range there of how they're going to interact with us on it. Thanks. Other people, how do you feel about changing the game?
I wonder if we're changing their game or our game, because I think if you look at the people that come into our company, and the joke I have with anybody coming in is, you're not here to get rich or famous, you're here to grow. And that's exactly why they chose to be a part of our team. And if we're holding back a growth opportunity from them, we're not meeting them on the bar that we put in front of them. And so within our learning environment, we're all very comfortable with that. Within the clinical skill set, that's what we all embrace. But the reality is people came to us for more than just clinical skills. They want to know where they should be looking and how they should be growing. So, and working in a young staff, we have a very young staff, and we've had some conversations with them. I don't think this is changing their game. I think it's changing our comfort with their game.
Great, thank you. Good pivot to thinking about this differently. Any other tables have something different that they talked about in terms of that reflection? Yeah.
We had conversations, I think.
Can you go nice and loud so I can get back?
We had conversations that all of us think, and to Dan's point a little bit, is the challenge in changing this game is the metrics aren't different, the game's not different. Us holding them accountable to a standard that we've tolerated for so long is the game we're changing, and that's very uncomfortable. Okay, I've done this for 5 years alongside you. Why now is it important that I change what I've been doing? I mean, that's on us, tolerating it for this long. It makes it more difficult to change.
Yeah. So one way to think about this, if you're in the group that still it does feel uncomfortable, or as you go to have these conversations, if you feel that discomfort, imagine if you were a coach of a sports team and you've gotten through your season. That's been the last, however long you've been with the company, that's our season. But now you're in the playoffs. You as a coach, if you've been on any sports team, you change the game going into playoffs, right? Even the refereeing, they change what they allow in most of those pro games at that level of the championship. So because we're going to great, that's the pivoting of this, is we want to help them be better. And in order to do that, we're going to hold them accountable to greatness, not just goodness. So as you think about if you do feel that discomfort, because I'm going to be really upfront with you. When we change the game and raise the standards on people in our company, and when we do it with our kids, and when I do it with my husband, I feel uncomfortable. I feel like I've been unfair somehow. It's just how I feel about it. I always go back to think of myself as a coach. Would I ever send my team on the floor or on the field thinking I didn't prepare them well enough, they're going to lose? I would never want to do that. And so that sometimes is what can help me through, because generally speaking, this is not going to be overly comfortable. It's not going to be like, oh, this is going to be easy. If it was, we'd already be doing it. And so would all the other companies that Dale Carnegie consults with, but it doesn't happen. So we just know that to be true. This is an execution barrier that exists. Feel free to come back and have these conversations with each other. If you get yourself to the point where you know you need to have a coaching conversation, and yet you're like, I have like 10 lists of excuses why I'm not going to do it. That should be a trigger. Come back and look at how you're thinking, what culturally might be getting in your way. You're going to have the tools and the skill set. We've got those covered. But mindset and culture are the two things that you'll probably need each other's help for. We have one more barrier that we want to talk about. This one will go a little bit faster. It's on the handout right there. And it's this idea of, I just don't have time to do one more thing. I will either do this or this, but man, I can't do it all. So I'm either going to do my paperwork or I'm going to see my patients. I'm either going to coach people or I'm going to see my patients. I don't know what you want from me, but I can't do it all. It's an either or mentality. This is, again, very culturally for most of us. Matter of fact, we've even celebrated this say no. Right, you've heard this, learn to say no. I mean, there's classes on it, learn to say no. So, and I'm not saying that's bad, I'm just saying in this cultural barrier, in this execution barrier, your people are going to push back with this. When you go to coach them to see their 10.5 patients that day, they're gonna hit you with, well, I'll do that or I'll do my paperwork. I don't know which one you want me to do. nicer people than that, I'm guessing sometime you're gonna get it. So one, be aware that it's out there, and what we're gonna replace it with is and. We're gonna do it and, we're gonna do that, and we're going to help you figure out how. It's not like you have to figure it out on your own, we're gonna figure it out together. The other piece of this one is then this idea of not being liked. A little bit is like the first execution barrier. I don't know if physical therapists really deal with this though, because I've been through PT before and I swear they didn't care about me liking them, because they pushed hard, right? I did not like my PT during the pain of my physical therapy. Now, I love them now, because I can use my knee that I had surgery on, and it's great, but during it, so you may not have this feeling where I don't like to be liked, but I will ask as a large group, what might be, perhaps, better than even being liked?
Respect.
Being effective.
Yeah, excellent, respected, being great. I mean, there are things better than being liked. And did we send out the video that's the thanks for the feedback?
Georgia?
Yeah, we did. So in that thanks for the feedback, if you had an opportunity to watch it, the other thing is give people a little room to not like you. Okay, you're leaders. Buck up a little bit. They may not like you in the moment when you're giving them the feedback. Now, if they carry it on day after day, then you got to coach on that. But in the moment, it could be a little uncomfortable. We are telling them something about them that's not performing. I know when my owners of my company come to me and give me coaching, I don't like them in the moment. I get over it. But I appreciate that they give me a little time to be human too. So on this one, we're gonna have the coaching process to help us through it, and we're going to have the practice today. So we're getting ready to get into where we're gonna roll out the process and coach. But I do want to check in. How much of this either or do you think we're gonna run into? Just reactions out loud. You think we'll have a lot of it? You think people will figure it out? Seeing some of this. Anybody else?
A lot.
Yeah, I think you're gonna run into it quite a bit. So as we work through the coaching today, there's a portion of it called sidetracks. That's where people are gonna push back and try to derail us from our coaching. We'll come up with some ideas as to how we can respond to that particular either or thinking. Be careful that we don't exhibit it. So that's my strong suggestion. Be careful we're not the ones exhibiting it to them in our own ways. Like, I didn't get my paperwork done today because I was seeing patients. We could sort of think of that again like this badge of honor. I work 12-hour days because I'm inefficient and can't get my work done. Or maybe not, but maybe, I don't know. Just be careful of how we put things out there in the world, okay? So we're gonna still be working on these. We will come back to these this fall and check in to see how many of these execution barriers really got in the way or how we're doing with them. For today, we want to move forward and say one skill and tool we have that helps us with both of them is the idea of relationship capital. We touched on it briefly. Dale Carnegie literally wrote a book called How to Win Friends and Influence People. Our entire company, which is over 100 years old and in every country but Antarctica, we have someone graduate from one of our programs worldwide every 20 minutes. I mean, so it's kind of a big deal. It's out there, right? These things work. I say that just to give you credibility that they work. Here on the page 3 of the handout, here are the principles that we believe help us with relationship capital. Not all of them are created equal. Not all of them work great in performance coaching or development coaching, but what we're gonna do is take a few minutes individually, reading through the principles, and mark ones that you think that would help me with performance coaching. That one seems like it would help me more with developmental coaching. So maybe a P for performance coaching, which is what we're doing today. A D as in developmental coaching for this fall. And again, the difference is one is black and white, one's subjective. So you're reading through individually, putting some D's or P's next to them, and then we will get a chance to talk at your tables some thinking. But go ahead and read through those principles, start to identify which might help us best.